Your compliance checklist for opening a treatment center is the difference between opening doors and losing deposits. Behavioral health is one of the most heavily regulated fields in healthcare. HIPAA, state privacy law, anti-kickback statutes, and marketing rules create a dense compliance environment from day one. Here is the compliance checklist for opening a treatment center in the order you clear each gate before your first patient. We walk zoning, licensing, federal registrations, staffing, and marketing certification, the gates that decide whether you open. Compliance at launch is not one approval. It is a sequence of legal, facility, and credentialing requirements that each clear before you operate legally. State behavioral health licensure is the non-negotiable foundation. Every state runs its own agency and its own application. Federal registrations, staffing credentials, and ethical marketing certifications stack on top of that license before your doors open. Committing to a facility before confirming zoning is the single most expensive mistake in treatment center startups, and it is entirely avoidable. Operators have lost $50,000 to $200,000 in deposits and improvements on facilities they could not ultimately use. Applications are often rejected because the Policies and Procedures Manual was a generic template, never customized to the program. Behave Health's all-in-one platform integrates CRM, EHR, and billing in a single system purpose-built for behavioral health and addiction treatment. A single integrated system is designed to reduce training burden, eliminate data silos, and streamline the revenue cycle. It can be operational before you admit your first patient, with HIPAA-compliant messaging and portal access designed to support privacy. 5 gates decide whether you open on schedule, clear them in order, and start them in parallel wherever you can. Miss any one, and your opening date slips by months. Let us walk all 5. Gate 1. Confirm zoning and local permitting before you sign any lease or purchase contract. Residential programs typically require commercial or mixed-use zoning. Outpatient generally needs commercial office zoning. Always consult a land use attorney and obtain written zoning confirmation before committing to a facility. Gate 2. Complete your state behavioral health license application, often 30 to 100 plus pages. Applications require a customized Policies and Procedures Manual, staff credentials, owner background checks, and a fire inspection clearance. Application fees range from $500 to over $10,000, and the full review typically takes 3 to 9 months or more. Gate 3. Obtain the federal registrations your services require before you can prescribe, test, or bill. DEA registration is required to prescribe controlled substances. A CLIA certificate of waiver is required for any point-of-care lab tests like urine drug screens. You need NPIs to bill, and methadone for opioid use disorder requires a separate opioid treatment program certification from SAMHSA. Gate 4. Screen and credential every clinical hire, and keep screening after they start. Conduct thorough background checks on all clinical staff. Convictions related to healthcare fraud or patient abuse are disqualifying. Federal healthcare exclusion screening against the OIG list is mandatory before hire and monthly thereafter. Gate 5. Get LegitScript certified before you advertise, and stay clear of anything that looks like a kickback. LegitScript certification is required by Google and Facebook to run addiction treatment advertising, and it takes 4 to 8 weeks to process. Avoid patient brokering, paid referral arrangements, and any practice that could be characterized as a kickback under state or federal law. Accreditation is not legally required to open in most states, but it is increasingly a practical requirement for payer contracts and government contracts. CARTH International specializes in behavioral health and addiction treatment, surveying every 1 to 3 years. The Joint Commission's Gold Seal carries deeming authority for Medicare and Medicaid, a significant operational benefit. Most experts recommend waiting 6 to 12 months to collect the outcomes data accreditation surveys evaluate. Plan for 12 to 18 months from initial planning to your first patient, and start credentialing in parallel with licensing, not after it. From planning to first admission is typically 12 to 18 months. State licensing alone runs 3 to 9 months. Insurance credentialing takes 90 to 180 days, and you cannot bill during it, so start it in parallel with licensing. Behave Health supports new treatment centers with software and consulting designed for the realities of behavioral health operations across licensing, technology, and billing. The all-in-one platform combines EHR, billing, CRM, and RCM, built specifically for addiction treatment and behavioral health. It is designed to support privacy with HIPAA-compliant messaging and portal access. Behave 360 Consulting provides hands-on guidance across licensing, technology implementation, billing, and operations. Stop treating compliance as an afterthought when you open. Book a 20-minute demo at behavehealth.com. See the all-in-one platform and Behave 360 Consulting built to support your launch at behavehealth.com.